Flavio Dino manages to circumvent President Bolsonaro's attempts to block medical aid reaching the Northeast. The number of confirmed COVID-19 cases in Ecuador passes 10,000. An Argentine musician, Marcos Munstock, iconic member of comedy musical group Le Luthier, has died. Hello, welcome to Telesur. I'm Carla Gonzalez, and this is from the South. Brazilian media reports that President Jair Bolsonaro has been trying to sabotage the left-wing governors in their attempts to fight the COVID-19 pandemic, and that Bolsonaro has been trying to block shipments of medical supplies. More on this report by our correspondent, Brian Meir.
8 of the states in Brazil's northeast region are governed by governors from left-wing political parties. And one of the most popular governors in Brazil right now is Brazilian Communist Party Governor Flavio Dino in Maranhão. Now, the governors in the northeastern states have banded together to try and work collaboratively to best respond to the coronavirus pandemic. And they've been fighting back against far-right President Jair Bolsonaro every step of the way. Bolsonaro has not just repeatedly called for an end to quarantine orders, which has been ignored by all of these governors. He's also tried to sabotage shipments of medical supplies, medicines, and ventilators to the governors in the northeastern states. So last week, after repeated attempts at getting ventilators into his state, Governor Dino smuggled 107 ventilators in from China, bypassing both United States government attempts to capture and sabotage the shipment and attempts by Bolsonaro to block ventilators from arriving in the Northeast. And today there was another victory for Governor Dino. The Supreme Court ruled that a company in Santa Catarina has to deliver 68 ventilators to Maranhão State within 48 hours. This is a shipment that was blocked by direct order from President Bolsonaro. So once again, as Bolsonaro tries to sabotage the governor's attempts to minimize transmission of the deadly coronavirus, which has already claimed over 1,700 lives officially in Brazil, the governors keep fighting back every step of the way and represent the only chance right now of Brazil's citizens to protect themselves against this deadly killer.
That was Brian Meir in Brazil. The number of COVID-19 cases in Ecuador has now passed 10,000, while the government is set to announce new economic measures to mitigate the impact of the pandemic. Our correspondent, Denise Herrera in Quito, has the details.
In a virtual press conference, the Ecuadorian authorities informed that Ecuador has now 10,850 cases of COVID-19, and now Ecuador has 537 deaths. The main point in this health crisis now is the economic situation. Actually, 2 commissions of the National Assembly are discussing the 2 projects of economic reforms made by President Lenin Moreno. Most of the Assembly members of the National Assembly are rejecting these economic reforms. They said that these laws will affect all Ecuadorian citizens. In this context, the Health Minister of Ecuador, Juan Carlos Ceballos, just talked, and he said that the government is taking all the preventive measures in all the hospitals of Quito and the country to prevent the spread of the COVID-19. But as we know, the complaints made by the health sectors, the professionals of the health sector, are still denouncing that they need the health equipment to face in the first line this pandemic in the country. As we know also, these 2 commissions who are discussing the economic reform will give their response in the coming days.
Denise Herrera from Quito. Trinidad and Tobago does not intend to open its borders anytime soon. The Minister of National Security said this was to prevent the importation of second and third waves of the COVID-19.
Our medical experts have advised that this measure is a necessary measure, and we will continue to keep our borders closed. Second waves. Persons who are observing what is going on, as we in the government are around the world, will note that anyone who started to relax their border control and allow persons to free flow or even restricted flow across the borders to certain categories, for example, their nationals, immediately began to experience a second wave that can be worse than the first wave of infection from COVID-19. the Minister of Health referred to a few moments ago. Singapore, one of the points of everyone looking at a few weeks ago, started to ease on their restrictions with their border control. Immediately a second wave hit them. Japan, states of emergency across their country, unfortunately, again because of the easing of restrictions. South Korea, and there are a number of other jurisdictions. Bearing all of that in mind, after consulting with our medical experts, we have no intention at this stage to allow our borders to become porous and allow persons a free flow of access.
Grenada is among the 20 countries around the world where Cuba has sent medical missions to help combat the pandemic. However, a U.S. blockade has been preventing many of these countries, especially in the Caribbean, from accessing medical supplies. We spoke to Dr. Darges Maya Lepkes, member of the Cuban mission in Grenada, about this.
The restriction in all the world is for everybody, not only for Cuba or Grenada or China or UK. But however, we working with what we have here in Grenada. We have all the necessary supply to help and give medical treatment or for all the people that have COVID-19 or for the prevention, because prevention is the most important to prevent the spread of the COVID-19. Basically, here in Grenada, we have the necessary resource, not everything that we want to have, but we have the necessary, and the ministry and the government, he give to us all the support and everything that what we need to prevent the spread of the COVID-19. Currently here in Grenada, we don't have too much people sick. The spread is low, but we're working together with the ministry and the government and the population to prevent that become more seriously.
We'll take a short break now. Join us again in a minute. Welcome back. More news at this hour. The famous Le Luthier band in Argentina has lost another one of its founding members, Marcos Munstock. The 77-year-old Munstock died after battling with cancer for over a year. He was the third member of the original cast to die. Munstock was an actor, screenwriter, and musician. His most famous character was Johann Sebastian Mastropiero, a composer who wrote the humor and musical pieces of Le Luthier. Also in Argentina, a nursing home in Buenos Aires has been evacuated after 20 people, 16 patients and 3 caregivers tested positive for the coronavirus. The city's prosecutor has opened an investigation into the possible failure in preventive measures against the deadly virus. The local media reported that family members told them that there were only 2 employees caring for residents and that one of them was an electrician. As of Wednesday, Argentina registers more than 3,100 cases and 152 deaths.
We managed to get them all transferred because they had no medical assistance here. 72 hours ago, they were absolutely abandoned. We do not know in what situation they actually left, what type of medication they had, how they are.
In regards to isolating them, it's difficult because it's necessary to isolate each one in one room. And it's not possible because if I have more patients than rooms while strictly complying with the building protocol, we can't. It's a factual impossibility. This situation was revealed to the Buenos Aires city government. But above all, the point was the lack of staff members. The nurses were infected. We were desperate.
Latin America and the Caribbean is set to experience the worst recession in recorded history as a result of COVID-19. The International Labour Organization says the region will see a fall in GDP of 5.3% in 2020 due to the pandemic. Additionally, 61% of Latinos working in the United States have lost their jobs, or part of their salaries, according to a study by the Pew Research Center. The head of the United Nations World Food Programme is warning that as the world is dealing with COVID-19, it is also on the brink of a hunger pandemic, adding that even before it became a global issue, the WFP had warned world leaders that 2020 would see the worst humanitarian crisis since World War II.
This might sound truly shocking, but let me give you just some numbers. 821 million people go to bed hungry every night all over the world, chronically hungry. And as Dr. Chu just pointed out, as the new global report on food crisis that's published today shows, there are a further 135 million people facing crisis levels of hunger or worse. That means 135 million people on Earth are marching toward the brink of starvation. But now the World Food Program analysis shows also, due to the coronavirus, that an additional 130 million people could be pushed to the brink of starvation by the end of 2020. That's a total of 265 million people. In a worst case scenario, we could be looking at famine in about 36 countries. And in fact, 10 of these countries, we already have more than 1 million people per country who are on the verge of starvation.
And agriculture ministers of the G20 countries held a virtual meeting and pledged to ensure sufficient global food supplies amid the pandemic. The ministers said, "We will work together to help ensure that sufficient, safe, affordable, and nutritious food continues to be available and accessible to all people, including the poorest, the most vulnerable, and displaced people." They also said it was important that coronavirus restrictions do not create unnecessary barriers to trade and food supply chains. Ethiopia Airlines, the biggest in Africa, is facing a $0.5 billion loss in revenue amid the global crisis caused by COVID-19.
All kinds of problems that Africa has suffered, we have always stood with Africa. We have never abandoned Africa in bad times. Will we be able to sustain with only 15% of our revenue, because cargo constitutes only 15% of revenue? For a short period of time, yes. But for how long? Very difficult to predict.
In Kenya, the government has placed a lockdown on Mandera County following an escalation of community spread of the coronavirus. Confirmed cases stand at 304 after 7 nationals tested positive in the last 24 hours. Interior Minister Fred Matiang'i said apart from a local shutdown, the government has locked the country's borders for an initial 21 days. The National Command Center on the coronavirus pandemic has also been ordered to review and strengthen the enforcement of public health measures in the counties of Mombasa, Kwale, and Kilifi. Authorities in China have once again condemned what they called conspiracy theories and false accusations spread by the U.S. government, while U.S. President Donald Trump has shown no sign of slowing down in fanning these flames.
China is a victim of COVID-19, not an accomplice, says Zheng Xuan, a spokesperson of China's foreign ministry, following the latest accusations made by U.S. President Donald Trump.
The virus is a common enemy of all humanity, and it can appear anywhere in the world. China, like most other nations, was a victim of the novel coronavirus. We are not accomplices.
China, along with the international community, have rejected the conspiracy theories and wild accusations without any scientific proof lobbied by the White House.
U.S. Senator Tom Cotton alleged the virus originated in Wuhan's Virology Institute. After this, the Washington Post and other outlets wrote about how the virus came from a lab in Wuhan. They have no evidence, nor any logical reason to make that statement. They say it is based entirely on a speculation. There has been no evidence showing that the virus was man-made.
Beijing has criticized the doublespeak of some Western politicians and media outlets, reminding them that in years past, none of them has asked the United States to apologize or take responsibility for other crises.
During this global pandemic, the international community has to come together. There is no time to throw accusations or demand that someone takes responsibility. I cannot recall something like the happening in 2009 when the H1N1 flu exploded in the United States and then spread to 214 countries, killing almost 200,000 people. Did anybody ask the US to pay for this damage? In the 80s, the AIDS epidemic was first discovered in the US and it has now spread all over the world. How many millions are infected? Did anyone ask the US to pay for that?
The COVID-19 pandemic has caused over 182,000 deaths across the globe, most of them in the United States, Italy, Spain, and France. Still, conservative media outlets and President Trump continue to speculate about the origin of the virus and attack China, a strategy that, according to experts, does nothing to save lives, but only works to divert attention from the failures of the US government.
Beijing, China. More stories after this break. We'll be right back. Thank you for joining us again. France has passed 21,000 deaths due to COVID-19 after recording 544 fatalities only on Wednesday.
There have been 13,236 deaths recorded since March 1st, 82% of which were people over the age of 70. There have also been 32 deaths in French overseas territories. In social and medical institutions, 8,104 deaths have been reported since the start of the epidemic on March 1st, and most of these deaths occurred in nursing homes. In total, since March 1st, 21,340 deaths due to COVID-19 have been reported in France.
The Spanish capital, Madrid, has closed a morgue installed in the ice rink of a shopping center as the country's daily death toll slowly stabilizes. On Wednesday, the government reported 435 new deaths, putting the total number to over 21,000. Meanwhile, some 86,000 patients have recovered from the illness and have been discharged from hospitals. However, the Spanish Congress has voted to extend this state of emergency until May 9th to continue pushing the numbers of new infections down. And another international event to be cancelled amid the global pandemic is Spain's popular Bull Run. It takes place during the San Fermín festival in the northern town of Pamplona and is held annually between July 6th and 14th. The event sees fighting bulls chase hundreds of people wearing white t-shirts and red scarves to the narrow streets of the city. And activists have rejected the announcement by U.S. President Donald Trump that he will temporarily suspend immigration. He said this will protect U.S. jobs during COVID-19.
Well, once again, President Donald Trump is seeking to distract the nation with his tweet that attacks immigration and attacks immigrants. This is not an issue that should be brought up at this moment. This is a moment in which the President of the United States should be working with our governors and with our local elected officials to safeguard lives. In this moment, I think that we as Americans need to see this for what it is, which is a distraction, and it's just one more call to racism, division, and xenophobia.
There's no merit in any such planned executive order. It's been demonstrated time and again, immigrants are job creators. They're a net benefit to the economy. And, banning the immigration of any person in the United States except for agricultural workers, it's not going to solve the coronavirus pandemic. It's going to leave us with a shortage of healthcare providers, people that are involved in transportation, pharmacy, grocery. It puts us at a disadvantage. It's not going to help us out of the problem Trump's made in mismanaging this pandemic. It's a distraction.
In the United Kingdom, the recently appointed Labour leader has slammed the government and accused it of giving a slow response to the coronavirus. He said the ruling party has failed to increase testing to control the spread of the virus.
Testing is obviously crucial at every stage of the pandemic. But we have been very slow and we're way behind other European countries. Now, the Health Secretary made a very important commitment to 100,000 tests a day by the end of April. But yesterday, the figure for actual tests was 18,000 a day, and that was down from Monday, which was 19,000 tests a day. So we're way behind the curve, and the end of the month is a week tomorrow. So what does the First Secretary expect to happen in the next 8 days to get us from 18,000 tests a day to 100,000 tests a day?
Our correspondent, Pablo Navarrete, has more on the situation in the UK.
The number of people that have died due to coronavirus in the UK could be as high as 41,000 people, according to an article published by the Financial Times today, Wednesday, in the UK. Now, the article has taken figures from the Office of National Statistics, which is the UK's leading provider of national statistics. It is tasked with carrying out the census in England and Wales every 10 years. It's taken the figure, which includes deaths from hospitals and outside hospitals. Now, the UK government latest figures for the deaths due to coronavirus are 17,337 as of yesterday, Tuesday. Now, these figures don't include hospital deaths. The new figure, which is more than double this figure, takes into account hospital deaths and looks at the recent trends in mortality. For example, on the week ending April 10th, it appeared that 75% more people died than would be expected. Now, this article comes in the context of increasing criticism of the Boris Johnson government's handling of the crisis. On Sunday, the Times, which is normally pro-government or sympathetic to the government newspaper, published an article which suggested that Boris Johnson hadn't taken the threat of the coronavirus sufficiently seriously, had dealt with it in a rather complacent manner, and now with a high number of deaths in the UK, perhaps this complacency is being translated into the high death rate that we are seeing, making the UK one of the countries in the world with the highest per capita deaths due to coronavirus.
That was Pablo Navarrete from London. Japanese authorities have announced 34 crew members on an Italian cruise ship docked in Nagasaki have tested positive for coronavirus. The Costa Atlantica ship has been docked in the southern port since January for maintenance. On Tuesday, one crew member was confirmed to have the virus. Officials said none of the 623 crew members have showed serious symptoms, and now they are being self-quarantined in single rooms.
On this cruise ship, there are no passengers and only crew members of about 600 people aboard, from what I understand. On April 20, tests on 4 people were conducted and 1 person tests positive. On the 21, tests on 57 people were conducted, and I have received information that 33 people test positive.
Protests in Lebanon continue for the second day despite the coronavirus lockdown. Hundreds of demonstrators drove around Beirut in a show of rejection for the political leadership, whom they blame for the country's economic and financial crisis. The protest coincides with a second day of a parliamentary session where lawmakers are discussing the creation of an anti-corruption commission and legalizing the cultivation of cannabis for medical and industrial use.
We are here today protesting against the proposed general amnesty law that has a lot of defects. Lebanese legislators are trying to approve this law to protect themselves of the corruption that they are guilty of.
And with that, we end our news brief. But you can find these and many other stories by checking our website, telesurenglish.net. And be sure to join us also on social media. For Telesur English, I'm Carla Gonzalez. Thank you for watching.